Now, you guys are allowed to inject Botox as well as fillers. How did this all happen?
Well, there's some legislation that recently got passed, and the laws have been passed to allow dentists to provide aesthetic services, not only therapeutic, but aesthetics, which makes sense because we've been dealing with the head and neck. I've been doing it for 25 years, probably give hundreds of thousands of injections. So this is a way for me to take my patients and provide a service in a more private, professional setting than maybe a Botox party on a Friday night.
And what was kind of the holdup with all of this? I know a lot of dentists maybe didn't do it and more were interested in doing something like this, so it kind of just had to go to the legislation.
These things require a lot of legislation, a lot of pushes. I think there's maybe a little bit of a turf war, I'm not really sure. But I feel as a profession, dentists are poised and they have the skill set to deal with the muscles, the nerves. They deal with the face all the time. So because when I provide veneers or crowns, I want to not only deal with the beautiful teeth, but I look around, it's like putting a Monet painting with a Walmart frame. We don't want that. We want to look at the soft tissue, the cheeks, the lips, and so forth like that.
And then let's talk about some of the results here. So obviously a lot of people know what Botox is, but just in case you don't, out there, our viewers, this is what happens when you get the Botox.
Alicia is a beautiful lady, but if you look at her, she has some folding on her forehead. So about 4 weeks ago, she got her Botox. So lift your eyebrows now, and it's gone.
Look at that.
So it gives people confidence, and it just helps restore and prevents that wrinkling for the future.
And what do you see, Dr. Ortale, in terms of you're kind of the groundbreaker on all this here in the state of Arizona? Do you see more dentists going to want to be providing this service, or?
I do. I believe anytime there's an opening of possibilities of things that we can do, training is important. So for me personally, I spent the last 4 years, gone to hundreds of hours of training. I've gone to 10 classes with Alicia, actually. And we've learned how to do lips, Botox, threading, all sorts of neat customized procedures. And so for me, I get to finally employ that. Like I have the backing now of the legislation, the laws, and my profession. And so I spoke to the Arizona House of Representatives about 6 months ago and helped get this launched. And so I'm ready for this. It's time to go.
And patients, so if they call you, they obviously, if they need a filling or some dental work done, can you do this all in one sitting, one appointment?
Yes. So I had a lady come in just this week who had massive migraines around her head. And so she's a new patient who needed therapeutic Botox. So Botox can work with muscles that cause migraines. And then when we were talking to her about some of the aesthetic services we have, she's like, well, can I do that now? Absolutely. And so for patients that might get cleanings and fillings, we look at it from a comprehensive standpoint. So I love the fact that I can do this in the position and in the environment that I do all my treatment. And the patients feel comfortable.
And you can just make it all good.
Yes.
Yes, and absolutely. It starts with the smile. You got to have a good smile,
absolutely,
right?
Absolutely, yeah.
I love that. Dr. Ortale, thank you so much. Yeah, so Ty, here we go. She's rivaling you. I think her forehead's probably one of the smoothest I've seen.
Oh, yeah, she's
beautiful.
Yes, she is.
She's like, can you please not get that camera so close? Thank you so much.
I know. She's so excited to be on camera this morning.